Hi, everybody. I'm so excited to be here with you live today. And what we're going to talk about today is interstitial cystitis. And we're going to do that with Joana Bartlett. She is hosting an exciting weekend workshop where we're going to dive into all of the different aspects of interstitial cystitis, the painful bladder, the hormonal issues, the pelvic pain associated with it. So as soon as I see her hopping in here, we'll be talking to Joana about her program, about her conference, and what I'm going to be talking about on that conference, which has a lot to do with hormonal health. So give me 1 second. Keep hanging on for a second. I expect to see her momentarily, and I'm going to pull up for us. Oh, here she is. Let's see. I think she has to. Here we go. Right. Let's see. Look at every topic we're going to be seeing on the conference here. Let's see. She should be with us any minute. I see her, but I don't see the ability to get her to join us. I think she has to reach out to me. Oh, she's having some tech issues here is what she's telling me. All right, hang on a
It
second.
worked!
Here we are.
Yay!
Welcome,
Sorry
Joana.
about
How are you?
that.
These things happen. That is just fine. Here, I want to look at the
Perfect.
the retreat information. So next weekend, starting on Friday, is Joanna's IC conference. Is ideal for both professionals and for people living with IC, correct? Is that correct, Joana?
Yes, that is correct. I'm so sorry. If I cut out a second, I'm just trying to move. I don't know what's going on with my connection, which is usually absolutely fine. So I don't know what's happening. So I've just see if it's a bit better up here.
No problem.
Is that better?
Yes, that's just fine. You're absolutely fine.
Amazing, perfect. Yes, so it's a retreat next weekend. Super excited for anyone with IC or practitioners working with IC, basically with the aim to give people the proper information from the specialist like Jessica, who knows all of the things about pelvic pain and conditions. So that's kind of the goal of it. So yeah, it's really exciting.
It
I don't
is,
want
yeah.
to talk a little bit about what you're going to be doing and what you're going to be presenting.
Yes, so as she was saying, there are many, many topics. It looks like you've got about 10 different speakers or so.
14, we've
14.
updated. 14
Excellent.
speakers, yeah.
Excellent. So you'll get everything from just the basics of IC, what is IC, what it's often sort of looks like. Here's the challenge with bladder pain issues. IC, someone can be diagnosed with IC, but really have endometriosis on the bladder or pelvic floor dysfunction, hormonal dysregulation. So I'm going to be presenting on two things on Saturday morning. So this conference starts, Joanna, on Friday. When on Friday?
Friday the 16th at 8 a.m. EST. So
Okay.
that's 2 p.m. for those of us in Central Europe, and 8 a.m. for EST. So very
Yes.
excited. Nice
And if
early kickoff.
yes, and if you're in California, just set your alarm for 5, or I'm sure you've got some recordings later on for
It's
people
all
in various
recorded,
spots.
yeah. Everything's
Yes.
recorded because it's
So,
so difficult to get all of the time zones to work properly. So in Australia, we've got quite a few people coming in from Australia.
yeah, and that's totally fine, so keep, you'll have access to that. But if you can, join us live because we will have some interactive time for questions, for answers. And so on Saturday morning, US East Coast time, I will be presenting on 2 topics. So we're going to start with the gut microbiome and how that relates to bladder health. Really interesting. Just earlier this week, I have a client with significant bladder issues. And when we did some lab testing, which we always do in our clinic, we found significant elevated markers of small intestine bacterial overgrowth and overgrowth of, non-beneficial microbes in the colon. I don't like to say good and bad bacteria because that's a bit of an oversimplification, although it's useful clinically. Um, and what the data shows from studies that have been published, gosh, some of them almost 10 years ago now, is that if you address just SIBO alone, not even really optimizing microbiome health throughout the mouth, throughout the small and large intestine, throughout the vulvovaginal canal, you can, in about 40 to 50% of the cases, bladder pain, bladder symptoms. So we really have to take a holistic approach, which is what's so great about this conference. When people have bladder symptoms, it's not always a direct impact of some kind of bladder issue, if you will.
Exactly.
Yeah. So we'll be talking about the gut
Exactly. And that's
microbiome.
been such a big thing. Yeah.
And then we'll also be talking about hormonal health because same thing, if we're dealing with bladder pain issues that could be related to low estrogen and, vaginal dryness, painful sex. I mean, we could kind of layer and layer and layer different circumstances that can contribute to the bladder pain. So talk about what inspired you to put together this conference.
Yeah, so I have IC myself. I've had symptoms for a long time, but it took so long to get a diagnosis. So that was sort of my first issue, was that I never really understood what was happening. And I think that's unfortunately quite a common sort of thing that, I see personally with my clients, with IC as well. And I found it so difficult to get the right information. So, I suspected that my gut had an impact on it, and I suspected that my nervous system did, and a couple of other things. But if, it's so difficult, and you take up so much time looking at things online and reading about things and researching everything. And everywhere I looked, I couldn't find anywhere where there was just everything that could affect your IC, and including some things like wellness aspects as well, right? So, incorporating things like pelvic floor yoga and breath work sessions for the nervous system alongside the doctors like yourself, Jessica. And we've also got a fantastic urogynecologist coming on as well, to really mix the two of them together so that we can actually get a really well-rounded view of what IC is. So all in one weekend, whilst being interactive, whilst being able to ask questions directly then and there to the specialists, and just make it fun and, and enjoyable. Because when you do have chronic pain, I couldn't do so many things that I wanted to do because I was scared that I would end up in pain, or that I wouldn't be able to find a toilet, or, there wouldn't be food that I could eat or whatever. So having it as well from the comfort of your own home, being able to nip in and out with recordings just kind of makes it so much more accessible to all of us as well, which, and creating a real community within that of everyone who's got the same knowledge as well, which is fantastic.
Absolutely. And I think what you said about the nervous system is so important. We'll dive deep into that, and
thing about any chronic pain issue, especially when it's integrated with foods you must avoid, is that we have to be so careful of the language around that, of the thinking around that, because we can actually exacerbate the circumstance. And there was a really good paper published about 3 years ago. I think, I forget the journal, but it was more of an integrative journal where it was really looking at that whole piece that, you know, if you sit down and you expect that lemon juice or whatever is going to increase your bladder symptoms, and it does, like almost immediately, that's a sure sign that it's your nervous system. And so we have this old, you know, survey data of people just being asked, like, what irritates your bladder? And then suddenly that's gospel for what people with bladder symptoms should avoid. And we have to be so careful, because when we think about avoiding doing things, avoiding eating things, avoiding participating in activities, and then we think about how that affects the neuroendocrine system, we really have to think much more broadly, because it keeps people very trapped in places that they're trying to be safe. They're trying to run away from that pain, because that pain is really intense and devastating. And you know, as you know, the frequency, the urgency, the sleeplessness, it gets actually exacerbated when we're not really mindful about how we maintain our recommendations. And so for the practitioners that will be joining us, I really hope you'll learn to think about IC and any painful bladder syndromes or any pelvic pain syndromes full way, which is why I was really excited to participate in this conference, because it does bring that approach. Of course, you know, if you have something like the labs I was looking at last week, where the bacterial microbiome and vulvovaginal microbiome were out of balance, we want to address that, but we have to do these things all together. Otherwise, we're actually potentially exacerbating the situation and making it last longer.
Yeah.
So
exactly.
I appreciate
and
you
it's also
bringing that up.
Oh, good. And it's also such a big thing, which I found, was that you don't know what you don't know. So, you know, you might notice that there's a pattern with your hormones, but you may have been told that that's not affecting it, or you of all of the pieces and giving everything kind of in one, just then all of the information is laid out so that we can really start to kind of put the pieces together and get an actual full overview of our health and think, oh, okay, and actually understanding exactly what could be happening in the hormones of IC. So it's super exciting, and I mean, I can't wait to also watch the entirety of it. So I think it's always fascinating.
Yes.
And yeah, I think it's going to be absolutely brilliant, really brilliant.
Wonderful. Well, what else do you want to share about the conference? How can people join? How can people sign up? How can people prepare to show up? You know, what should they be bringing and doing, and what mindset should they show up with?
Yeah. First, well, I think I'm happy you touched on mindset. Mindset is a huge part of chronic illness as well. So coming with an open mind, and we've actually got somebody coming on to talk about mindset and all of that sort of stuff. Coming with an open mind to learn about everything and to top up knowledge is crucial. You know, coming with an open mind when we're doing practices like psychedelic breath and like emotional release and all of these things is also really important. And then the retreat is from the 16th to the 18th of September. So 8 days away, which is terrifying and fantastic, and I can't wait.
That's right.
You tickets from in my bio. And also there's a discount code, which is, correct me if I'm wrong, Jessica, I think it's Jessica 10, isn't it? To get a discount. Correct, as well, yes. From tickets purchased through through there. So yeah, it's really exciting. We're really focusing on kind of a whole body. So we've got pelvic floor physio, we've got endometriosis, SIBO and IC, we've got hormones done by yourself and the gut, nervous system, the pain-brain connection, mindset, pelvic floor yoga, psychedelic breath. We've got somebody coming on to talk about sex and intimacy with pelvic pain, which is such a big thing. I can't even remember. I'll be talking about nutrition. I'm also a part of this as well. I'll also be doing a talk. So, and there's loads more as well, which I can't remember off the top of my head. So it's super exciting. We're just looking at the whole body, top to toe. We're going for the lot, and putting it into a weekend and making it fun and enjoyable as well as educational.
Yes, absolutely. And I like the pace of it. I like that you've got so much, so many different speakers and so many different approaches, and everything in reasonable bites, and bring your burning questions, because we have a little time for that with each speaker as well. So bio, and you can use my discount code Jessica10 to get reduced pricing on your tickets, and do that as soon as possible. The program will kick off on Friday of next week. Thanks so much for being here,
Super
Joana.
exciting. Amazing.
Right.
Thank you so much for having me, and I can't wait. Thank you, Jessica.
Me too.
Thank you.
All right. Bye-bye.